Sometimes when I sit down to reflect, I'm telling myself like this work would not have happened in Madagascar if MAF was not there, because the roads were just simply terrible.
My name is Wouter Nagel. I'm one of the pilots here in Madagascar. I work with MAF, obviously. And we've been flying Mercy ships for almost 3 years now. They started flying with us in September 23. And since, we've done so many flights with Mercy ships. And including this year, we'll probably go and reach over 400 hours to have flown with Mercy ships, which is which sounds like a lot of hours, but if you translate that into how many hours we've saved them traveling by road, we're not talking hours, we're talking months. We're talking many months they should have otherwise driven on the road. And it's been a very rewarding experience to fly for Mercy ships. To see the team pick them up from one location, patient selection team, for example, they go and assess the people in the field who are eligible for treatment on the ship. And then we pick them up from that location and we fly them to the next one. And sometimes there are no roads between those places. Or they have to travel back first to the main capital for a few days and then drive to the next destination for a few days. Let's say a week on the road, and we can fly them in 1 hour.
You're meeting some very brave patients doing this job, and it's very much an honor. And a blessing to meet all these patients and their families that walk over these narrow paths to come to a larger town to see if there's anything that can be done. And I think that's special about the work that MAF is doing, in being able to reach those communities and get so close to the patients.
And looking at the landmass in Madagascar, it's a really big country. It takes days to travel to other neighboring districts or regions around. It's been a life-changing experience for me. Just hearing from our registrars and from our patients saying they needed to walk 3 days to get to the hospital, it makes me want to always keep trying and never give up. Because if people always carry this hope with them that someday help will come, even in this remoteness, and even if I have to travel for 3 days to get to this hospital, then I also feel like I always need to show up for my patients. And I do that always, and I'm just thankful.
So to be able to do this kind of work, it's really a blessing, and it brings me joy, because I feel like patient selection is where the mission is beginning. And this really takes a lot of planning, beginning from registration, and now we're doing field consultation to make sure that they are physically fit to be seen by the surgeon. So this is very important because we are able to interact with their patients, we are able to listen to their stories, and we are even able to understand deeper how best we can be able to help them before we send them to the ship.
We can't sail the ship in the country, but I think that's kind of where our organizations meet each other, because our patients are in the country, and so for us having the opportunity to fly to these more remote places, to these places that are hard to access, is really a blessing. And then having our safe surgical platform on the ship, that we can provide these surgeries and aftercare and releasing them back into the community burden-free. No additional care is needed, and they can continue to be a blessing to their families and their communities. I think it's beautiful to see that partnership there and see that we can come together in this world.